So, good evening and a warm welcome to all the dignitaries present here. I'm Sreushi from Clarinet, serving as the allocated session assistant to ensure a seamless experience. Clarinet stands as India's most relied upon digital platform, offering a multitude of enriching services exclusively for the doctors. It is with great pride that Clarinet serves as the digital partner for this event hosted by the Indian Medical Association Medical Students Network, and the focus of today's session is Clean Air Conclave. So let's begin today's session, for which I would like to invite Dr. Arijit Bansal sir to take over. Sir is a distinguished medical professional currently serving as the national convener of the IMA MSN. With an exceptional academic and leadership background, he is owning his clinical skills as a resident medical officer at Pushpanjali Medical Center, Delhi, while actively contributing to the medical community through his participation in various curricular and co-curricular events. Dr. Vansal's academic achievements are equally impressive as he has earned recognition in debates and research projects. His scholarly contributions include the publication of 3 original research papers and 1 review paper in well-indexed journals, reflecting his commitment to advancing medical knowledge. In addition to his clinical and academic pursuits, Dr. Bansal is deeply passionate about environmental health with a keen interest in improving air quality. He actively advocates for the benefits of breathing clean air, is committed to incorporating preventive measures into his practice to promote better respiratory well-being. With numerous colleagues with a forward-thinking approach to healthcare, Dr. Bansal exemplifies dedication, leadership, and a continuous drive for excellence in both medicine and public health. So without much delay, sir, I would like to hand over the session to you. Arijit, sir, over to you. Please proceed.
Uh, Shreyasi,
Yes,
thank you
sir.
very much for introducing Dr. Arjit Bansal, but I believe he was with us till about 2 minutes back. But I believe we've just received a message from him that he's got some network problem and he's trying to join. So I think what we'll do, as doctors, we should always be prepared for all kinds of exigencies and emergencies. And since Arjit is not able to join, no problem. We'll move with the second item on the agenda in the program, which is an address by me on the issue of health impact of air pollution and to introduce the Lung Care Foundation and the Doctors for Clean Air movement. Since Arjit was supposed to introduce me, so no problem. Allow me to introduce myself. I'm Professor Dr. Arvind Kumar. I'm presently chairman Institute of Chest Surgery, Robotic Chest Surgery and Lung Transplantation at Medanta Medicity, Gurugram. Earlier, prior to this, I was chest surgeon at Gangaram Hospital. And prior to that, I was professor of surgery at All India Institute of Medical Sciences, New Delhi. I actually served at AIIMS New Delhi from 1976 when I joined as an undergraduate student to 2012 when I took retirement from there from the post of professor. So about 35 years of stay at All India Institute. I'm also the founder trustee of Lung Care Foundation and the Doctors for Clean Air Network. With that introduction, now I would introduce to you this program today is being co-hosted by Indian Medical Associations Medical Students Network, uh, especially with the kind support of its chairperson, Professor Shalabh Gupta. And it's being co-hosted by Lung Care Foundation and Doctors for Clean Air and Doctors for Clean Air and Climate Action. So, few words about Lung Care Foundation. Lung Care Foundation is a non-governmental organization established in 2015 for the purpose of care and cure of 2.6 billion lungs in India. 2.6 because that time 1.3 billion was the population of India. The three main goals of this foundation are: number one, as you can see on your left side of the screen, to raise awareness about the issues which hurt lung health. And since air pollution is one of the leading causes of hurting lung health, therefore, majority of the times our talk is around air pollution. However, I must clarify that our primary goal is to establish lung health. We also have a lot of research activity going on in the same field, and of course, clinical care as doctors, it's always. So awareness, research, and clinical care in the field of lung health. With that motto, it was set up. A lot of people ask me that you are a doctor. What is a doctor doing in the field of air pollution? When to answer this question, I show them this photograph. So this, friends, this photograph is a real life photograph taken during a thoracoscopic surgery. Thoracoscopic surgery, where we put a telescope into the chest and do the operation. It allows us to record the pictures. On your left side is the picture of a healthy pink lung as we are born with. And to your right is the picture of a lung of a person who has been exposed to air pollution. You can see what air pollution does to the lungs. It converts pristine pink lungs into almost something which looks like a hole. And as a chest surgeon, I operate on 4 to 5 patients every day, see their chest. And this is what I have been seeing day in and day out for the last decade and a half or 2 decades. And this is exactly what forced me to come out of the OR and start talking, because I, as a chest surgeon, am privy to this information. Not everybody is. You might wonder that, okay, it's happening in adults, but children. So this is the picture of a teenager born and brought up in Delhi. You can see even teenagers are now having their lungs destroyed. So friends, it is these pictures which have brought this surgeon out of the OR into the field of air pollution. In order to show to people, I can't take everyone to inside the theater. Of course, I can show them pictures, but I can't take them to theater. So to show what's happening, we did this experiment where we set up a lung replica. Day one, it was pure white. And after being in the air and with air passing through this artificial lungs, you can see in 5 days' time, it turned black. So this is what air pollution is doing to us. When we look at the health ill effects, often people ask me which organs are affected, and I show them this picture on the right hand side. You can see from the head to toe, there is hardly any organ, from brain to eye to nose to heart to lungs, liver, GIT, pancreas, urogenital, skin, endocrine, genitourinary, bone, joint, blood. There is no organ in the body which escapes the ill effects of air pollution. Short-term effects when you are suddenly exposed, allergic reactions, headache, nausea, but ultimately it affects brain, it affects heart, it affects lungs, it affects kidneys, it affects GI tract, reproductive system. Worst of all, these effects do not wait for us to be born. Now there is data that the pollutants in the pregnant lady's blood pass through the placenta into the growing fetus, and it starts affecting them from the intrauterine life, causing all kinds of congenital problem, and this continues till death. So air pollution is not a chemical issue, it's not an environmental issue, it's a pure health issue. And that's the reason why this program has been organized today, that we, the doctors, the medical students, the health personnel, health professionals are the one, because we see the health ill effects firsthand. So we get motivated. And secondly, when we talk to people that it's not a chemical or an environmental issue, it's a health issue, people listen to us. So we are motivated and we are a good motivator. So I call doctors as the motivated motivators as far as spreading this knowledge is concerned. And that's why within the Lung Care Foundation, in 2017, we created this group called Doctors for Clean Air and Climate Action, which is just a group of doctors who are passionate about this topic. It was again created for the purpose of raising awareness so that we use the power of doctors hours to convey this information to the people. We awaken people to this danger and we make them take the actions which need to be taken so that we can clean up the air. We engage with doctors, we educate them, we support them. We got about 40 odd pulmonologists from across the country and got them to launch. After that, we after the launch, we did various regional launches. We went to Parliament House. We went to various national medical associations. Nearly 20 associations today are a part of our organization. We went into community research, and our first research paper was published in 2020, where we showed that more than one third of the school going children in leading schools in Delhi were suffering from asthma. So similar activities, and we realized that if this movement spreads across the country, if all the doctors start talking about it, we 100%, I assure, 100% will be able to make a dent in this problem. Today, we have 8 state chapters across the country. We have had 3 leading research studies. We have reached out to more than 3,000 doctors, hundreds of medical students, various other schools, a large number of children, citizens have been engaged. 21 national associations of doctors are involved with us, and we regularly reach out to print and electronic media to spread our information. It's a totally apolitical body. Only requirement for anyone to be a member of it, you should be a doctor and you should be committed to the cause of clean air. If it is so, then you can be a part of Doctors for Clean Air. So a lot of people ask me, okay, what can doctors do? It is something which is to be settled by politicians. Yes, ultimately decisions have to come from the executive and the political leadership. But before that, there is a lot of things which can. So we can educate. I realized during my travels across the country that even health professionals are not aware of a lot of issues. So we can educate. So I have PowerPoint presentations which can be shared freely with anyone, and anyone can then share this information so that all health professionals are up to date on the health ill effects of air pollution. We can become clean air champions. So you can see there are over 7 states today where a lot of doctors are active and leading this fight, but this program needs to spread across the length and breadth of the country. So I invite all of you to become clean air champions in this area. These are some of the examples. We can lead the initiative. So if any one of you happens to be from a specialty, cardiologists, physicians, all any of the specialties, you could lead this movement in your association amongst your peers and spread this information. Again, we need, a lot of times people keep saying, oh, there is no Indian data, there's no Indian data. So I exhort all of you to go into the field of conducting research on this area. Lot of videos. We all know the power of videos. So we invite all of you, whether you are a medical student, intern, resident medical officer, a consultant, or a practicing physician, surgeon, anywhere in the country. Today, the power of social media, the power of net can be exploited. You can make videos, and we encourage videos in regional languages where we will be very happy to support you about the content, and you could make videos and spread amongst the people. So educating and engaging with health professionals, identifying and supporting the regional clean air champions, having chapters in different cities, states, towns, engaging with national medical associations, research, creating videos, and then engaging with media. We all know the power of media. Media people also have a lot of wrong notion about this. So we can reach out to them. We can have stories published because that increases the reach. And through all this, ultimately, we can try to influence the policy makers to make the policies, because ultimately it is the policy. However, when there is public pressure, public demand across the country, the policy makers will also listen. So we have created a lot of resources for doctors to be able to do all this. We have a lot of material on our website. which is www.dfca, doctorsforcleanair.org.in. Our numbers will be displayed during the course of this meeting. Any one of you can reach out to us. All this information is available for free downloads on our website. Please reach out to us, take this information from us, and spread this Doctors for Clean Air and Climate Action movement across the country to achieve the 7 goals that we have set. Any and every doctor is invited to be a part of this. It's not only our professional duty, it's also something which we need to do for the sake of ourselves, our families, our children, and our future generations. With that introduction about the health ill effects of air pollution, about Lung Care Foundation, and about the Doctors for Clean Air movement, and a call to every health professional to join this movement. Now it's my great honor, privilege. Arjit is there. Okay. I think I'm informed that Dr. Arjit now has been able to join. So I would hand over to Arjit. He has already been introduced uh, by the host. So it's over to you, Arjit. And then I'll come back and introduce the keynote speaker for today's evening, Professor Shalabh Gupta. Over to you, Arjit, in case you are logged in.
Hello. Thank you
Yes,
so
Arjit, go ahead. Over to you.
Thank you so much, sir, and sorry for this technical glitch. So, all the distinguished doctors, esteemed medical students, and honored guests, a very good evening to all of you. It is with profound respect and immense enthusiasm that I extend a warm welcome to each of you as we are gathered here to commemorate the International Day of Clean Air for Blue Skies. This day serves as a powerful reminder of the vital connections between clean air and public health, a connection that we, as healthcare professionals, are uniquely positioned to champion. Today's event is not just a gathering, but a call to action. It is an opportunity to unite our efforts and reinforce our shared commitment to ensuring that the air we breathe is as clean as the care we strive to provide to our patients. Our mission is clear: to leverage our expertise and passion to tackle the pervasive issue of air pollution and promote a healthier environment to all. I would like to extend a special and heartfelt welcome to our distinguished guests whose dedication and leadership have been instrumental in advancing our cause. Dr. Arvind Kumar, sir, the visionary founder of Doctors for Clean Air, an unwavering commitment and tireless efforts have been pivotal in spotlighting the urgent need for cleaner air and mobilizing the medical community to take action. His leadership serves as an inspiring beacon in our collective journey towards improving air quality. Our Honorable Professor Dr. Shalabh Gupta, sir, Chairman IMA MSN, Sir's strategic guidance and visionary leadership have been crucial in shaping our advocacy efforts and driving meaningful change. His insights and contributions are deeply appreciated as we work together to address the challenges of air pollution. Dr. P.S. Bakshi, sir, from IMA Punjab. Sir's dedication to public health and his proactive approach in tackling regional issues related to air pollution has significantly contributed to our collective efforts. His engagement is vital to our mission's success. Dr. Sandeep Jain, sir, from IMA Meerut. Sir's active involvement and advocacy are instrumental in bringing the attention to the health impacts of air pollution and advancing our goals. His contributions are greatly valued. Dr. S.K. Latsar from IMA Gorakhpur. Sir's commitment to address local challenges and promoting cleaner air practices is commendable. His expertise plays a key role in our broader mission. Dr. Pradeep Singh sir from IMA Gautam Budh Nagar. Sir's leadership and focus on improving air quality and public health resonate deeply with our objectives. His efforts are integral to our cause. As healthcare professionals, we are actually aware of the significant impact that air quality has on the health. From respiratory ailments to cardiovascular conditions, the effects of air pollution are far-reaching and demand our urgent attention. By coming together today, we have the opportunity to share our knowledge, collaborate on innovative solutions, and strengthen our resolve to advocate for policies that we will lead to cleaner air and healthier communities. On this International Day of Clean Air for Blue Skies, let us embrace the chance to reflect on our achievements, recognize the challenges ahead, and renew our commitment to make a difference. Every effort, whether through research, advocacy, or patient education, contributes to a larger vision of the world where cleaner air is the is actually the need. Thank you for your dedication, your expertise, your unwavering commitment to this essential cause. Together, let us take this opportunity to forge a path towards a future where air we breathe is as vibrant and life affirming as the health we strive to protect. Welcome once again, and let us embark on this important journey for the determination, unity, and hope. Thank you so much.
Thank you very much, Arjit. That was a very, I would say, stimulating and very encouraging message from a young, budding medical professional who's the future of the uh, medical field of this country, who's actually not only a present leader in the field of medical students network, but also has a very, very promising future. So these words from you, Dr. Arjit, are not just words, they are very, very meaningful messages which are going out from the MSN leadership to the membership, thousands of them across the country. And I think, Arjit, these stimulating words from you would go a long way in stimulating each and every medical student in the country to become a kind of champion for the clean air in their local areas. And that precisely is the goal and aim of Doctors for Clean Air. So once again, thank you, Arjit, not only for this very stimulating message, but also for being there for this cause and for your commitment for this cause. Thanks, Arjit. Now it's my very, very pleasant duty and in fact an honor to introduce my younger brother, my friend of more than 25 years, and a very, very distinguished person from the field of surgery in our country, Professor Dr. Shalabh Gupta. Dr. Shalabh Gupta is presently the Professor of Surgery at Santosh University and Medical College, Ghaziabad. He is also the Dean Academics there, but much more than that, he's been a very, very leading member of the Association of Surgeons of India, which is where I got to know him. He's been very active for almost 25 years. He's been a past member of the governing council, a very leading active person there. And he's leading some of the unique initiatives, one of which is developing a kind of uh, a program for all the persons to be insured, which is called insurance scheme, which was pioneered by him. So, and also when we contacted him about 6, 7 years back to be a part of this Doctors for Clean Air network, he was immediately available. And I must admit from that day till date, anytime and every time we've reached out to him, he's always been forthcoming. In fact, I visited his medical college just a few weeks ago to address the faculty, residents, and all other people. It's indeed an honor for me, Professor Shalabh, to invite you to give your keynote address on this topic, medical leadership in the field of air pollution. Professor Shalabh.
Thank you very much, sir. Sir, it is an honor for me actually to speak in front of you, and thank you very much for giving the opportunity. And today is a special day because I am speaking in front of my two gurus. One guru is Dr. Arvind Kumar, because he's not a guru for me only, but is a guru and a mentor for most of our surgical fraternity. Second is Dr. Pradeep Singh sir. So he has been guiding the UP IMA for a long time, and his practices and his vision is entirely commendable, and it is he does with passion. So that's how. And my friend Dr. Sandeep is there from Meerut, and rest of the dignitaries, Dr. Bakshi and everyone are there. My kind regards to them. And Arjit is my student only, who has been very hardworking, and he has grown with time. So I believe he is going to do very well in future also. So thank you very much. So I begin my address, sir. And so let's bit about the clean air. Sir has asked me to speak upon how the medical leadership is going to affect. So I go back to my old days, sir, and these are my old days where I was up just like a medical student, like Arjit is there. This is my MBBS days, and you can see the Chambal River at the background and absolutely clean. That time we used to have those photographs where we used to click and take out the print. That's why the quality of these photographs is like that. But we had a wonderful time, and we never thought about air pollution at that time. This of Delhi where we used to just enjoy. And these flowers you can see just now, you don't see these kind of flowers. If they are planted also, they go in 1 month time. So that's why it is very, very good that at least at that time we had such wonderful flowers. And this is the current scenario where the deterioration of the AQI is being done on a daily basis. And we are basically thriving on rains. So once these rains come, our air quality becomes better. If the rains are not there, again, we get a deteriorating AQI. And we are flooded with all sorts of diseases, and these diseases have started coming, including viruses, including these epidemics and pandemics, new diseases which we saw. And then we had a natural disaster at Uttarakhand and recent floods which happened in Kerala. And then there are some storms which have been going on all around the world. I don't know what is happening. Floods, fires, and earthquakes. Ultimately, the burden goes on to us only. And what I am worried is the small little children, they are the first people who get affected. Old age people, pregnant women, they are also affected. So this kind of picture we want to see where everyone is not having a mask and they breathe the clean air very, very nicely. But what we saw during the COVID time started from here, Wuhan, and this virus struck us. Zoonosis had taken place with bats, and healthcare workers were on the forefront like a soldier, and we were without a gun. We had a lockdown. We fought without gears, lack of manpowers, and no knowledge how to fight the COVID. All our hospitals were full. Football fields were also turned to hospitals. They were also full. And this is the state of affairs where we first learned the art of wearing a mask in a proper manner. Although as a surgeon, we used to wear the mask in the OT for some time, but here we were wearing the mask all the time while we were sitting in the hospital with shields together. So we were under tremendous pressure, and many of the healthcare workers, they basically left the job, and there was very, very difficult working conditions also. And we were stressed, tired, and many of the doctors, they expired, the healthcare workers, they expired. There's a data which says so many people expired in India and abroad also. So it says that more than 1 lakh doctors, healthcare workers worldwide. Health, of course, till today has been the last priority of the government. So I'm thankful to Dr. Arvind Kumar for leading the movement of clean air, because this is going to make an impact. And that's how we joined hands together 6 years back. And last year, it was IMA President Dr. Sharad Kumar Agarwal, who was also leading a front. And we had a meeting at Hotel Andaz in the Aero City on 2nd of June. And it was very wonderfully conducted by Dr. Arvind sir, because he had brought in all the association presidents and the secretaries from all over the India. So that's how we gathered together. And this year, sir had been kind enough to come to our university on 16th of July to give a kind of a briefing on air pollution, and we were all benefited. So who's responsible for all these things? For air pollution, all of us. And this is a small data which I want to project, that in India, there are premature deaths. In the world, there are premature deaths of the tune of around 7 million. 33% of them have cardiovascular deaths. 43% had COPD deaths. And air pollution has caused 29% of lung cancer deaths. These are all certified data from WHO and other. 17% of all acute lower respiratory infection deaths in children under 5 years. So it has caused a huge burden. Not only the economic cost has gone up to $5 trillion, but healthcare cost has also risen to $1.4 trillion annually. And in Asia, if we take the data, we have got 3.2 million premature deaths annually, as per the WHO data of 2018. So there is a need for medical leadership, and that's why we are here together, joining hands with Dr. Arvind sir and the Lung Care Foundation, who is a Guinness Book of World Record holder. And here we have to create some kind of things, like we have to create an educational awareness. So what I mean to say about educational awareness is that these lectures have to go on. Wherever you go for a lecture, as a doctor, small CME, we should devote somewhere around 2 to 5 minutes of time to speak on air pollution, because we are all active in so many platforms, which include the IMA, which include our social bodies, which include the general public also, because as a professor of surgery, I have to go for community outreach also. This is one of the activity we had. I was addressing all the police personals, and multiple activities we done and we did. And then we had a lecture on lung cancer also, lung carcinoma. So these are some of the activities. And our second role is to give a proper diagnosis, recognize, address air pollution related health issues, respiratory problems, and what can be the different diseases which can have, as Dr. Arvind said just now, not even a single organ of the body is spared. Every organ can be affected. So here we have got to take onus of diagnosing and treating these patients also, and also the preventive measures by reducing the exposure to poor air quality, avoiding heavily polluted areas. I don't know how much air purifiers, but people are purchasing air purifiers, they're putting at home. But the most essential part is, like in Japan, people wear masks all the time. So this is a kind of thing which we have to take it as a preventive measures, and we cannot let the non-stop challenges dishearten you. So we have to move forward. And this is how we have to create some activity. We have to participate. We have to inspire our own people. We have to motivate our own people and other people, because we are in a busy hospital. Everywhere we can spread the awareness. We can have partnership with organizations and spread awareness, and some initiatives to be taken to improve the air quality. And when I say that we have to call to action, because once we call to action, then so many things we can do, like we can do research, we can develop a policy, and we can advocate things. We can have a sustainable healthcare goals. We can give encouragement for medical professionals to get involved in clean air initiatives. And all these things ultimately lead to some kind of financial engagements which are needed, which has been aptly provided by Lung Care Foundation. They have been helping us to spread awareness also. And as a doctor, it is our duty to take control, to take care of all the rest of the things. So here, these things become very, very important, because here we have got some kind of constraints. I don't say constraints, or you can say just kind of opportunities which have not been given to us. Like we have got some political and regulatory barriers. Like now the Delhi part is going towards the winters. And as soon as we start towards the winters, there is kind of air pollution which is going to increase, and generally it comes from the burning of the fossil fuels which come from this area of Punjab, Haryana. So these kind of things have been tried, but due to some kind of political problems, these things are not issued, not solved. And then what happens is that the Delhi comes into a severe high AQI. So we have to take care of the opportunities for collaboration and innovations, and we have to also leave aside our some priorities and heavy workloads. Everyone is working, but main thing is we have to take some time so that we can have some priority on air, better air quality also, and we can advise. So these are the barriers which have been to the medical leadership on clean air, but resistance to change and lack of support from stakeholders has to be taken care, because in future the fittest of all of us is going to survive, and those people who are not going to take care of themselves, not doing exercises, not taking proper precautions, they are going to vanish. So we have to join hands, work and liaison with all organizations, and with great humility and self-awareness, I pray that all should be healthy. And this is very important. We are not going to get the second opportunity to rebuild our own planet. So this is the first and the last opportunity. Take maximum use of it. Ours is a beautiful planet. Let us save us together. So thank you very much. Thank you, sir, for giving the opportunity.
Well, thank you very much, Professor Shalabh. It was a beautiful and very stimulating narration of not only the problem which air pollution is causing and will continue to cause, but you very effectively also conveyed how much role a medical professional can play. I would just repeat two parts of your presentation. The last slide, beautiful, very powerful slide. We will not get a second chance to build our planet. What a beautiful message to show the urgency for the call for action. If the time for action was yesterday, we didn't. But if we don't do anything today also, we will probably have no tomorrow. And the second part you said in the beginning, as medical professionals, we are highly respected in the society. People listen to us, and we are often invited to not only medical events, but a lot of social events. And if each one of us makes a commitment that wherever we go, whatever we are invited to talk, and as Professor Shalabh elegantly said, that before that, if you just devote 3 to 5 minutes to apprise them of the problem of air pollution and some suggestions, I think it will. So, Shalabh, I'll take these two picks from a very beautiful talk you gave, that each one of us to make a point that wherever we go, we talk about it. And second, we keep telling people that we will not get a second chance to rebuild our beautiful planet. Thank you so much, Professor Shalabh. That was a very elegant keynote address. Thank you so much. And with that,
Thank you,
I
sir.
move to the next. Thank you, Shalabh. Thank you once again. I move to the next part, which is a very, very absorbing and involving a lot of people who are in different parts of the country, but working towards the same goal. It's my honor to introduce the panelists in this panel discussion. First of all, Dr. P.S. Bakshi. Dr. P.S. Bakshi is one of the senior most surgeons from the city of Jalandhar. He's been very active and finance secretary of the Association of Surgeons of India in the past. He's been a past national vice president of IMA. He's been past president of IMA Punjab. And presently, he is the chairperson of the Doctors for Clean Air movement in Punjab. And I must say that under his leadership, a lot of on-ground action is taking place in IMA Punjab. And he has started some unique initiatives, which we'll discuss as we put the questions to him. It's again my honor to introduce Dr. Pradeep Singh. Dr. Pradeep Singh is a senior physician from Greater Noida. He's the past president of IMA UP. He's the current president of IMA Greater Noida. He is the chairperson and the leading force behind the Clean Gautam Budh Nagar Forum for Clean Air. And I would like to share that it was under his leadership that we had a meeting couple of weeks back in Greater Noida, where the Greater Noida Forum for Clean Air was started. Again, my pleasure to introduce Dr. Sandeep Jain. Dr. Sandeep Jain is a senior physician from the city of Meerut. He is the current president of IMA Meerut. He is the chairperson under whose leadership the Meerut Forum for Clean Air. So these are city-based forums for clean air, which we have been starting in different cities. The first one was done in Lucknow, then Meerut, then Gautam Budh Nagar, and the last one was in Gorakhpur and also in Punjab. And these have been IMA leadership-led initiatives, but a very multi-stakeholder kind of activity. So Dr. Sandeep Jain was leading the show at Gautam Budh at Meerut. And last but not the least, it's my pleasure to introduce Dr. Lat. Dr. Lat is a senior pulmonologist from the city of Gorakhpur, a leading member of the Chest Club at Gorakhpur, and also a leading light of the IMA Gorakhpur. And it was due to his untiring efforts that we had launch of Gorakhpur Forum for Clean Air recently in the city of Gorakhpur. So I'll start from Dr. Bakshi, and my questions to all the panelists will be common in the sense that my first question would be that what motivated you to devote your time to work on clean air? It's each one of you is a busy practitioner. So what brought you into this field? That's part one. Secondly, can you share one activity that you would like all others who are taking part in this meeting to know, to take note of, and to try to emulate in their respective areas? So what brought you in this field, and one message, one activity which you would like others to show? I would start from Dr. Bakshi. Dr. Bakshi, we would like to hear your views, and then I'll move to my three other esteemed panelists. Dr. Bakshi. Kindly unmute yourself, Dr. Bakshi. Just unmute yourself. Dr. Bakshi is right now traveling. He's on his way back to Jalandhar and he's joined from his car, but I'm sure we'll be able to hear from him. You'll need to press the unmute button at the bottom. Yes. Welcome.
Good evening,
Dr. Bakshi.
everybody.
Welcome.
Good evening, everybody. I'm traveling on my way back from Delhi. And thank you, Dr. Arvind, for organizing this wonderful symposium and a wonderful interactive session. I was involved in tree plantation and a little bit of things with the environment. And when Dr. Arvind invited me to join this, we thought it was a very great opportunity and not to be missed. So we launched the Jalandhar Forum for. I am from rural Punjab, and like Dr. Shalabh said and Arjit said, winters are coming into Delhi, and there's going to be a lot of pollution. And to extent, maybe tree burning to a large extent in Punjab and Haryana and Rajasthan contributes to air pollution in Delhi. My village is a small village, and we are not a law enforcing agency, but repeated requests and repeated visits to the village and trying to explain to the villagers that what they are doing is absolutely a wrong practice, and that is not only dangerous to them and to the community, but also causing a lot of harm to the soil and to the microflora and small insects and animals. And over repeated requests and counseling in the village level, were able to convince at least my village that there is no paddy burning in my village and surrounding 5-6 villages for the last almost 6 to 7 years. And this is noted by a lot of probably the print media. There's a channel called The Print, Shekhar Kapoor and Shekhar Gupta. They covered this and they were surprised. We involved the students of local colleges to have nukkad nataks in the village. And we have been able to convince them to some extent that they are now not burning paddy in those villages. So my message to everybody is that since we are not a law enforcing agency and our job is only to create awareness, and was very happy to know that medical students are joining in now. MSN has been a very, very strong and very integral part of IMA, have been in IMA at the national level. If the medical students join us, they are the best people, our best ambassadors who will start and later on lead us to Doctors for Clean Air in our various villages. So my message is very clear that keep on trying, and awareness and repeated uh, educational CME seminars in colleges, in villages. It has made a lot of difference in Punjab, and I'm sure it will make some impact in other states and other places also. That is my message, Dr. Arvind.
She, you mentioned that there are villages with whom you are associated, and for the last 5 to 6 years, there has been no crop burning in those villages.
Actually,
Is it
sir, what
true?
happens is actually what happens is when you burn paddy, that field becomes black. So even if after 4 or 5 days you visit that field, it is like black in color. So when the Doctors for Clean Air team was in Punjab, and we had to cover 2 colleges. Once we were done, so I said, we have time, let's go to my village. So practically, that was a time when paddy was being cut, and practically we all saw there, and they could not spot even one which had any black field in practical. So repeated visits to the
think Dr. Bakshi has some connection. But friends, what I was trying to mention is that Dr. Bakshi, as a doctor, with his persistence, with his perseverance, and with the power which a doctor commands, has been able to achieve, which a lot of politicians and law enforcement agencies, with all the power at their availability, have not been able to achieve. And that exactly is the power of a doctor as an influencer, as a motivator. And that precisely, friends, is the purpose of this meeting today. That if all the doctors across the country start taking up this issue, we don't have any administrative, executive, or penalizing power, but we have a very strong power, and that power is power of persuasion, the power of motivating, and power of motivating from a position of strength. People listen to us. So if we tell them that it's a health issue, it's going to hurt you, harm you, they will listen. And I think there cannot be a more solid proof of the power of a doctor as a motivator than what Dr. Bakshi just mentioned, that there are villages in his area where for the last so many years there has been zero paddy burning in a state where 95% of the area is actually afflicted by paddy burning, despite all the efforts by the politicians and the law enforcement. I think a very strong message from Dr. Bakshi there. And with that message, I'll now move to Dr. Pradeep Singh, who represents IMA, past president, IMA UP, and now president of IMA at Gautam Budh Nagar, chairperson of Gautam Budh Nagar Forum for Clean Air. Sir, my question to you is same. What motivated you to come to this area of air pollution? And like Dr. Bakshi, could you also give one or two special areas or special services or special movement that you have done, which others can take as a message that here is the power of doctor as a motivator for this field? Over to you, Dr. Pradeep Singh. Kindly unmute yourself, sir.
Thanks, Dr. Arvind Sharma, sir, to invite me as a panelist in this important panel discussion. Nowadays, air pollution is a public health emergency. Air pollution is just like a new tobacco. Simple breathing causing so many type of disease and so many deaths per year. Dr. Sharaf tells 7 million per year. In India, air pollution is very common, especially in post-Diwali in winter seasons. 99% of Indian population breathe polluted air that is above standard by WHO. According to Air Quality Life Index, if average index could gain, every Indian can get 4 year more life expectancy if they get good air per year. As a doctor, doctors experience the pain of patients. They examine, they know what are the side effects, so they can tell better than others to the patient. And patient are also listen their words. And so doctors are the best motivator. Doctors can also transmit the different study in the international level for air pollution, and patient will accept the study because these studies show what are the type of hazards by air pollution. Doctors talk to their patient and also their families. They are more likely to be able to motivate them as they talk from a position of strength. So doctors are the motivated. We see mostly pollutions in November, December. We as a doctors also feel so much eye burnings and difficult. Really, last year I am also feeling difficulty in breathing due to such type of pollution. Burning in the eye is very common. So doctors can motivate society very well. So rest is tell by Dr. Sharaf and you. Thanks, sir.
Thank you, Dr. Pradeep. I would reinforce one of the key message. I mean, he gave many messages, but one which I want to reinforce because it's a new area. Doctors can also be useful in translating complex international and national studies in the field of air pollution into simple to understand messages, which were, some hi-fi research is done, say, in some university in US. That result is published in Lancet, NEJM. The general public does not have access to Lancet and NEJM. However, we, the doctors, can pick up that study, understand the study, translate it into very simple, easy to understand message in an audio or a video format, and then give it to people that as per a study that done by this person, this is what was found. And based on this study, this is the message for us and this is what we should do. Dr. Pradeep, I think you've given a very important message to all of us for another dimension where doctors can help in the spread of information, because this is the exact question asked, what all can we do? So Dr. Bakshi mentioned about one aspect, and I'm so happy that Dr. Pradeep Singh has mentioned about a new aspect. Thank you very much once again, Dr. Pradeep. And now I move to Dr. Sandeep Jain, who's a senior physician from city of Meerut, president of IMA Meerut. and chairperson of Meerut Forum for Clean Air. We were fortunate to have this launch of Meerut Forum for Clean Air a couple of months back, entirely due to the efforts of Dr. Jain. He was the one who was leading from the front. And I'm happy to inform that they actually involved the local police in a very big way. And that actually led to some unique outcomes from this, about which I won't tell. I'll hand it over to Dr. Jain to tell as to why he got involved in this movement, question number one. And two, the key activities which you have done, which, sir, you would like to share with colleagues from across the country. Over to you, sir.
Good evening, everybody, and I'm thankful to Dr. Arvind to make me a part of this panel discussion of this Clean Air Conclave. And my personal views, I'll stick to the points. And right from the beginning, when I started my practice, I had a feeling in my mind how to help the people, do something for the society, and being a doctor, what I could do. So my religious gurus and all, I had a discussion with all of them, and what unanimously all the gurus told me that if you are providing health, good health to your patients and the society, that would be the best charity you can give in your life. So this thing came in my mind that if I do, rather than making something or donating money or doing something, the best part what I can do, the God has made me a doctor, so what I can do is the best charity is to give good health to the society and the people. So this was my first aim. Then right from the beginning, I was in the practice, I was doing charity. I'm running 2 charitable OPDs and doing charity lot of every doctor does every day. But still there was something in my mind that I was not able to cater a large number of people. So how could I reach a large number of people and I could do good for the large community? So this was in the back of my mind. And I was fortunate enough and lucky to have Dr. Arvind in a meeting, and we had discussed, Mr. Rajiv was also there, and we had a meeting, and this thing came to me that if we go for this air pollution matter, then we can by and large serve a larger group of people and a larger group of doctors. So this is why I joined this group and I went for the air pollution, because I can reach masses and I can provide health to lot many people, which I could not do individually in my clinic. So this was my motive behind joining, number one. Number two, what were the different things I did? I planned in 2 ways, that if we create awareness to those people who have lot of impression on the society, then this my idea will propagate, or our forum idea will propagate into a large number of people. So I made a core committee. I made a core committee in Meerut who were interested in the environmental pollution control. And this core committee, this included ADM City, from MDA, from traffic police, from various authorities. See, so I have around from schools and from Nagar Nigam. So we have made a core committee of around people from 20 different departments. And what we are doing is, first of all, we are motivating them, because if they get motivated, they can propagate our idea to the larger number of society, which individually I cannot as a doctor, or maybe my team not be able to reach to the masses. So first of all, I involved these people. I gave them the idea, what you have to do, how serious this problem is, and when can we do. So this was the first part I did, and we are having a core committee, and we are creating a Zoom meeting every 15 or 1 month, so 15 days a month, so that we can be in touch and propagate our ideas. This number one I did. Number two, what I found is that if we focus on the children, and the school going children, and educate them and then motivate them and tell them to tell the parents and all in different parts and teach the other people, this would also give a good impact, because whatever amount of pressure we give to the society, people, because they they are reluctant about this issue. But I found that the children and even the students, medical college students, other students, they are the people, they are person. If we focus on them and we convince them, these are the people which they will propagate our idea, what we want to say, how serious the problem is, and then finally, what are the ways out of it. So what I did is that we had a team of doctors which are in contact with various schools and various colleges, and there and then we are carrying out different activities in various schools of merit, and we are educating them how serious this problem is and what are the means. And again, we are also requesting them that now you go to your home, tell to your parents, tell to your friends that how serious this problem is. And we have prepared a very good slide. Definitely we have got help from from Dr. Arvind also, and from Mr. Rajiv also, that we have got a very good, we have prepared our own talk where we are presenting all these things along with the measures how to control. And this we have given to the schools also. We have conveyed to the schools now. Once in 10 days or 15 days, you play this videos to your school at the time of assembly, so that they come to know how the ways how you can do it, and this will keep on banging them in their minds. And we have also requested all the students to plant a tree on their birthday and the parents' anniversary, and take care of the plant, because if you plant on the occasion of that, you will take care of that. And you just take care around yourself. Don't be relying on the government, what the government is doing. Be a part of controlling the pollution, air pollution yourself, and just take care of yourself, your home, around your home. And if all of us do it, the whole world of whole India will become air free, pollution free. So this is our approach, and we have already started on this, and we have done so many talks in different schools, big schools having thousands of students together. We give lectures, we give them ways how to control, and we request them. And another project we are going to take up is now that we have all told all the schools that you just find out which students you feel, or you find out, you just survey in 1 month, tell your teachers, tell the medical department of yours, which other people or which are students you find you suspect, and we'll go once in a month and we'll take our spirometer to your place, and we can really search out and find out, do a survey and make out how many students are there who are really going to develop or maybe having some part of asthma or respiratory problem which they are not knowing it. So this third part we have also taken. So I feel these are the projects we have taken, and my request to the MSN students is that you also take interest in the similar way which we have taken, because the thing which we have already told, that doctors are the person, not only the society but the officials, but the doctors, the students, all they take our talk as a very serious thing and they follow it. So we are the person, students, if we see, first of all, we should know why it is important to know what is the environmental problem and pollution. If we are convinced, only then we can do, because in small parts alone we cannot do it. So we should have a project in that way, that we should teach the teachers so that they can teach the further students and leaders. So this is way, and this is how I have progressed and proceeded. Thank you very much.
Brilliant, brilliant. Absolutely wonderful, Dr. Sandeep Jain. You've covered so many aspects. You started from saying that you were looking for a noble cause, that apart from practicing routine medical things, you wanted to do something which could reach out to more people, and you found that air pollution was the area where you have the power to benefit a huge number of people. I also actually exactly thought so, that instead of just taking out a few lungs every day, diseased lungs in the OT, if I can help in preventing these diseases, I think we'll help much larger population. Number one. Number two, you mentioned that you involved a lot of, and these are messages for all of us. That's why I'm repeating. You involved police, the district administration, the schools, colleges, the local intelligentsia, the principal from various colleges. You involved the local traffic police in a big way, business organizations, and anyone from the civil society, including the political leadership, the press. You made a multi-stakeholder action group. You first gave this knowledge to them, as you said, they can motivate people only when they are motivated. So the message for all of us, reach out to like-minded people from different stakeholder groups, apprise them of this proverb, kind of indoctrinate them or empower them with all the material so that they become as motivated about this as you are. Then they will become your force multipliers. And last thing, a very powerful tool, children. Dr. Jain mentioned that they decided to harness the power of children to spread this message. And I just saw a lot of newspaper clippings from the activities they have done in Meerut. They've reached out to a lot of schools. This has been very extensively covered by local press, which will actually encourage more schools to reach out to them. And if with all schools become the fountainheads for spreading this information, I think the Meerut city will start seeing the impact very soon. So very powerful messages there, Dr. Sandeep Jain. Thank you so much. So it's been a brilliant, I think time is up. So I will sum up. Dr. Bakshi gave a very powerful message that he, by his perseverance, persistence, has been able to achieve what the law enforcement agency could not. His village is today crop burning free. Dr. Pradeep Singh gave a very solid message about what all doctors can do. But one thing which stood out very clearly was when he said that we can help in translating complex medical research into easy, simple to understand messages, which we can share with the society in the form of newspaper items, audio clips, video clips, or presentations, which will help people understand. And then Dr. Jain mentioned about involving multiple stakeholders from your city, empowering them, encouraging them to become the fountainheads of spread this information, and lastly, harnessing the power of children. So I think the panel, I would like to thank Dr. Bakshi, Dr. Pradeep Singh, and Dr. Sandeep Jain for highlighting so many different, but all aimed at achieving one goal, and that is the goal of clean air. And I again go back to Dr. Shalabh Gupta's last slide. There will be no second chance to create this beautiful planet. I think all this has beautifully summed up the urgent need for action, the powerful role which doctors can play, a roadmap as to how we have given solid examples from 3 different cities as to how doctors can lead the way and help. I think a lot of messages have gone out. And if our student network esteemed members can pick up these threads and start spreading this information, I'm sure a lot of action will happen on the ground. With that, I conclude this panel, and I would like to now hand over to Professor Shalabh Gupta for his concluding remarks, summing up of the session, and for giving a few tips about the road ahead for the MSN. Over to you, Professor Shalabh. Shalabh, unmute yourself.
Thank you, sir. Thank you, sir. Thank you. Sir, actually, it has been a wonderful session. I think whenever I meet you, I listen to you, it encourages me more and more all the time. And you are doing so much for the noble cause. And you are putting so much of effort despite being so busy with your clinical work, operative work. That is a kind of a salute to you, because it is not easy. That the kind of surgeries that you do is the most complex surgery that I think one can do, like robotic surgeries. And this issue of air pollution also is like beating your head against a wall, where people listen to you, but they are not ready to come out with some kind of positive inputs. They don't want to actually act. But one thing I realized, that in our locality also, while our sweepers, they used to burn those kachras outside our homes where they used to collect. At least that thing has stopped over here. And after that, this awareness now in the children also, and the people are also becoming more and more prone for avoiding the air pollution. So this movement we have seen in Delhi has been going on, but as far as Pan India is concerned, we have to actually lead this movement. And this year, while I was chairing the MSN with Arjit, we brought him up, and he has very nicely worked, passionately worked, and he added 3,000 new students to the membership. So we grew from a mark of 10,000 to now 13,000 MSN students. So this is a kind of a very good movement where there is a 30% increase in the membership. So these 13,000 are our messengers, sir. So we are going ahead with, because we are now covering 18 states. And we have got the membership not only from the states, we have got membership from Andaman and Nicobar Islands. We have got membership from Chandigarh, from the Union Territories also. So this is how we can proceed. And I promise you, sir, that in all the public forums, wherever I am invited, I am going, I am definitely going to talk, and I always encourage these kind of things, because one thing you gifted me very beautifully, which I placed at my university, that was a AQI meter, if you remember, sir. 6 years back, we got a gift from you. There was a poster and there was a AQI meter. This we placed in our university over there. So the moment was like everyone who was coming over there, they used to see the AQI meter. And immediately they used to get alarmed. No, 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 we have to do something. So planting of trees movement has to be taken care by all of us. It has to become a movement, because once we plant more and more trees, the problem or air pollution will be lowered. This is the simplest thing that we can actually do on outside our homes. Apart from taking all sorts of awareness lectures, planting of trees can be done right away. Secondly, these sessions, I think we need more. We need to have these sessions. We can arrange some sessions with all states on Zoom platform for an hour. It does not take much time. And we can have these kind of sessions with some local bodies, associations, like those associations like Rotary, those associations like Lions Club, those associations which are basically taking the community ahead. So here also we can do it. And then during the conferences, wherever the conference is happening, 5-minute slot on air pollution has to be taken, sir. So I think this is how we can move forward and we can spread awareness. Our ultimate goal, aim is to spread awareness so that the people realize. And once this chain starts forming, it will go up to the last person. And at least schools can be educated. There can be so much awareness in the schools also, because these small children are going to go home, tell their parents that we have to take care of air pollution. So this is my take, sir.
Very, very strong message there, Dr. Shalabh. Very strong message. I think all those who are part of this program and who are listening to you, I would repeat the what you said in the beginning, that as doctors, wherever we go, whether it's a social function, even if we go to meet a friend, just talk about air pollution. Just talk about the role people can play. Whoever is there, every meeting, every outing that you have, if you just devote, each one of us devotes 2-3 minutes to this topic and tells them Dr. Shalabh's last slide, there will not be a second chance to recreate this beautiful planet. The chance is only now. Plus what Dr. Bakshi, Dr. Pradeep and Dr. Sandeep have told about beautiful work they are leading in their respective areas, which is making a difference on the ground. None of them has talked theory that, doctors should do this, should do. They have all told the actual ground achievements which they have made in a very short time. So very strong message. So I think with that message that so number one, air pollution is a serious health crisis facing all of us. Let's be clear in conveying this message. Number two, it's not that only government can do. Air pollution is caused by all of us, and each one of us can make a difference, even if it's a small difference, even if it's a minor difference. I think minor difference made by 150 crore people will become a major action. So please be clear. each one of us can make a difference. And third, last point, for creating awareness so that people are awakened and start taking the actions. We, the medical personnel, are the most important, most powerful, most motivated motivators, and we have learned how we all can start this movement from one part of the country and spread it across the country. And I think if we all do it collectively, there is no reason why we should not be able to make a difference. The movement against smoking in US was led by American Medical Association. The movement which led to nuclear non-proliferation treaty was led by the doctors. And I think a time has come where the movement against air pollution also has to be led by the doctors. With that message, we come to the end. And towards the end, it's my very pleasant duty to thank Professor Shalabh Gupta, Dr. Arjit Bansal, Dr. Akshay Yadav, and all others from the IMA Medical Students Network for giving us the opportunity to associate with us, sharing this platform, and co-hosting this program with all of us. It's also my very pleasant duty to thank each one of the members of the Lung Care Foundation office, Doctors for Clean Air office, but I'll mention two names specifically. Our CEO, Mr. Abhishek Kumar, whose persistence, perseverance, and constant goading that no, we've got to hold this. We actually wanted to host this program with IMA. However, we all know that IMA at present is involved with a very major battle on a different field. And therefore, this program was organized, against that background. So it was his persistence that no, we must have this program, that this program was held. I would also like to thank Dr. Ridhma, who's the deputy manager of programs for Doctors for Clean Air, for coordinating with all the participants and leading this program. My thanks to Shreyasi and Ritu from Clarnet, and of course, my thanks to all the participants, Professor Shalabh, Dr. Arjit Bansal, the panelists, Dr. Bakshi, Dr. Sandeep Jain, Dr. Pradeep Singh, Dr. Lat, who probably could not join, and all others who have taken part. Thank you so much. I'm sure the messages that we have conveyed today, all of you would take this message. We at Lung Care Foundation and Doctors for Clean Air will be very happy to provide any slide set, any other material, any research study, anything you need. Just reach out to us, write to us, contact any one of us. We don't want to be the face in your area. We want all of you to lead the battle in your area, and we are there behind the scene to give you all that you need to become leaders for this movement in your respective area. With that, once again, thanks to everyone for joining in this program, and I would like to hand over to Ms. Shreyasi for closing this program on behalf of Clarnet. And I would like to thank Clarnet and all the members in Clarnet for giving us the platform on which this program has been hosted. Thank you, Shreyasi. Over to you.
Thank you, sir. Thank you so much. Thank you so much, everyone, for giving us the opportunity to host the session. And we hope to have you again on our platform very soon. Thank you so much. Thank you, sir. Thank you, everyone.
Thank you
Good night.
and good night. And wish
Right, sir.
clean air
Right.
to each one of you.
Thank you, sir. Good night, sir.
Good night.
Good night, sir. Good night, everyone.
Good night, sir.